Thank you. I'm a special advisor at the FIPRA International Network, but I'm also advisor to the Finnish Ministry of Social Affairs and Health and the Finnish Innovation Fund, Sitra. That's possible because I worked for 20 years in Brussels, 17 in the European Commission. I retired in 2018, and now I'm, in a sense, trying to bring some of these European Union digital health things into the different actors.
So I'm aware of many hats, but as you know already, I'm Stefan Buttigieg. The role that brings the bread on the table is my role within the Ministry for Health, where I'm the co-lead of the data management team within the COVID-19 response team. Quite a long title there, but it basically takes up all my day, and my job looks pretty much about policy and implementing policy. So that's my day-to-day work. But I'm also the co-founder of Digital Health Malta, which is a non-governmental organization to push and raise awareness on digital health in Malta. And I'm working within UFA as the vice president of the UFA Digital Health section. So they have a number of sections, UFA there. Working within the World Federation of Public Health Associations as representing students and young professionals. And I'm also working with the Malta Association of Public Health Medicine. I'm trying as much as possible to lead their digital efforts in that regard. So doing a couple of things, but at the same time, it also allows me to have a widespread view, more global view, more holistic view, so to say, of the whole situation when it comes to health innovation. Over.
Thank you. Good day, everyone. It's truly a pleasure to be here and see some of my friends and engage in a conversation. I run a think tank called Nasta Lab, and what we look at is technological innovation, but a dimension of it that is often not well studied, and that's the diffusion of innovation. Once an idea comes to market, comes to clinic, its adoption, its adaptation by clinicians and patients is often a struggle. So I spend my time looking at the diffusion of innovation. My background is actually in cardiovascular physiology and cell biology, but spent the bulk of my career as the chief creative officer, chief strategic officer, and unit president of a company called Ogilvy, the largest healthcare communications company in the world. So I jokingly tell people that I'm bilingual. I speak medicine and I speak marketing. And I think it's the combination of those two disciplines that can truly drive transformation. And it's a pleasure to be here.
Fantastic. Thank you. It's a pleasure to have you and all of you here. As we stated at the beginning, we do want to squeeze every minute of today's discussion to have you tell us your perspectives and your positions on this topic. So in this first part of the forum, we want to be focusing the questions on policy trends and challenges. So specifically here, we seek a better understanding based on your perspective and your experiences regarding what is the current context in which data and digital solutions and access fit within the current global trends, what are or what should be the current priorities, and what do you think are the major challenges to increase access to quality care using data and digital solutions. So from that, our first question, which I have here, goes to Dr. Paya Tapani. So as a special advisor for the EU and having had such extensive experience in working with the European Commission, we wanted to understand, where does Europe stand in terms of the use of data and digital solutions to healthcare? And are there areas within Europe progressing more than others? And if yes, where, and why are these progressing more?
That's an interesting question. Where does Europe stand? Because of course, Europe is a collection of many countries, and these countries represent a spectrum of cultures, ways of organizing healthcare, levels of economic development, and also digitalization. So I don't think that there is one answer to that. And then, of course, even if you think about the European Union, which is the 27 member states, even there, the differences between countries are vast. But within the European Union, there definitely has been progress in digitalization in all countries, and the European Union as a union has been promoting this digitalization. But we have to remember that in the EU, the treaty for the European Union says that the responsibility for organizing healthcare is the responsibility of the member states. So the European Union doesn't have any direct impact on that, but it has a major stimulating impact. And there has been a lot of collaboration recently, and member states who normally are quite careful to guard their own rights in healthcare, they have seen the value of working together on digital health. So there are many levels at which the member states are working, really from technical to legislative. And one of those examples where the progress has been made in Europe has been exchange of data for primary or secondary purposes. Primary purpose means in treatment, and the secondary purpose is for research. And there have been a lot of progress. And interestingly, the European Union has been promoting actions at EU level. And many member states whose digitalization has not been at that level nationally yet, they have taken the message, well, we also need to develop our own systems. For example, several countries who didn't have an electronic prescription, when the Commission and the European Union started promoting cross-border electronic prescription, they realized we need to have our national system in place. And this collaboration across national borders, in the European Union, is called My Health at EU. It has actually been very interesting case because we are aiming at having all member states joining it. For the moment, it's about a good dozen countries who are exchanging e-prescriptions or patient summaries. We, of course, in the European Union, there was a lot of problems which we encountered during this process, but because when you try to link those different healthcare systems in different countries, obviously they have also different information systems, but it has been actually quite good progress there. Then your second part of question is, well, how does the Europe stand in relation to other parts of the world? Well, there are some brilliant examples in Europe. First of all, the country I know best, Finland, our neighbors, Sweden and Denmark, the Nordic countries, they were the early pioneers in digitalization. They were helped by the fact that they were smaller countries, they were cohesive countries. The digitalization in general has been very at a high level. I will come back to some other countries a bit later, but then the question is that how can different countries learn from each other? Of course, there are in the other parts of the world, there are also countries who are doing spectacular success. Israel, for example, or South Korea. But the true question then always is that, can you transfer those healthcare digital systems from country to country? That is not always not so clear. But what is clear? That you can learn from each other. And so, because the member states have, for example, they have this responsibility for their own healthcare, but they still can learn from each other and copy the best practices.
Thank you, Tapani. Yeah, collaboration and learning opportunities. Thank you for that. A follow-up question for you in this sense is that we have that key multinational organizations recognize the potential of data and digital health solutions to accelerate country progress on the health-related SDGs. In your opinion, what could be the role of data and digital health solutions in advancing access to quality healthcare?
I just spoke about the early pioneers who were pioneering in the already years ago digital health, but we also have here in Europe some late pioneers. I call them pioneers because they have actually done excellent job. We have two countries which I could use as an example. One is Estonia, a small country, 1.5 million people next to Russia, became again independent when the big changes in Europe happened. And they had to decide how we, a small country, 1.5 million people, how can we make our mark in the world? So they decided that we go digital. It's e-everything, it's e-Estonia. They decided to go for e-voting. They decided to go for all bureaucratic processes e. And then, of course, they decided to repeat the same in healthcare. They, for example, started creating genomic databases. They started creating electronic digitalized healthcare, and it has been a great success. And of course, Estonia is not the richest of the countries, which shows that a country who decides to do good work on digital, they can do regardless of their economic development. Another good example is Portugal. Portugal is also not the richest of the countries, but they decided also some years ago, and they had the political will, and they had the intellectual capacity, they had the skilled people there who decided to make a countrywide national digital system. And they were enormously successful. And they were learning from these early adopters. And actually, they made so rapid progress, these late pioneers, that they actually reached the level of the early pioneers very quickly. And so I think that this is a beautiful example that the digitalization and use of data is not dependent on your economic level, but it's more dependent on your will to make use of it.
I thought that Tapani's comments were excellent. And he said one word that really jumped out at me that I think it's worth considering in the context of the first question, and that's the notion of transfer. That sometimes it's difficult to transfer, data, knowledge, wisdom, whatever you want to pick, between countries, between cultures. And that's true, but in certain instances, it isn't. That we live in this exponential world. And I'll cite an example. It took 67 years for the airline industry to reach 50 million users, right? That was a functional transfer, understanding safety, transportation modalities. It took 3 years for Facebook to reach 50 million users. It took Pokemon Go 19 days to reach 50 million users. And I think this is the essence of exponential change, where the transfer is almost instantaneous. I mean, if you were to plot that, it would almost go to zero. And sometimes I think that it's incumbent upon culture and society to be open-minded to embrace the changes. So the transfer of knowledge is a very, very interesting thing. So I think Tapani hit the nail on the head in that it's an important dynamic that actually transcends the idea itself, but the slipperiness of the idea.
John, thank you for that. And I think you touched a little bit upon the question that we wanted to ask you in terms of, like, as you're quite a global strategic and creative thinker, and we wanted to ask you, what do you think are the key trends related to the use of data and digital health solutions in healthcare that you have observed in the recent years? So you just mentioned something about that. And how do you think that this has affected or is currently affecting access to quality healthcare?
I'm going to have to unpack that question a little bit. There's a lot of issues there. Certainly, a defining element of the world we live in today is a simple 4-letter word, And that word is data. Data, I've often referred to as the third fundamental window into humanity. The first was the telescope. And we learned a very interesting lesson from Copernicus about, well, just what happened to him. The second was the microscope that allowed us to see a world that we did not know existed. But once we focused it through the microscope, we could see this new reality. I believe that data and big data is similar to that it is a fundamental transformative aspect of our lives. Now, the companion to big data is the lens to the telescope and to the microscope. And that correlate is artificial intelligence. And I want to take a step back and ask a question. Do you want your clinician to be ill-informed? Would anyone answer yes to that? Well, of course not. We want our physicians, our caregivers, our nurses, our technologists to be optimally informed. The problem is it's impossible in today's world. The ability to assimilate information into a functional and practical clinical perspective is impossible. Therefore, the answer becomes yes, our clinicians are suboptimal in terms of their ability to process data. That's a big problem here. I would like my clinician to know how to best analyze my genomic profile. It's available, but it's certainly not going to get used. I would welcome the opportunity for my physician to be able to understand what clinical trials might be available to my father or mother or aunt. The reality is that it's just not happening. That's because our ability as humans to assimilate this information is inconsistent with the amount of data that's coming at us. And I think that's probably the most important insight today, that we live in a data-rich world, but we live in the context of the frail human construct. And I use those words very deliberately because it gets people a little nervous. The frail human construct. I think that we have to look past our human skills and recognize that technology is not only an option, but it's an imperative. So to me, I think that that is the fundamental reality in the world today, that we can make clinicians almost, if you will, more human, because we can enhance their cognition. We can enhance their vision using technology to see things. We could enhance their tactile ability to suture a fine cut across the eye using robotics. We can use stethoscopes. We can use a device like this to listen to heart sounds, and we can digitize those heart sounds, and we can listen to them in the context of knowledge. So functionally, we're making clinicians hear better. So I think that's sort of the fundamental reality that lives in the world today. And it's both interesting and unsettling because it goes back to this duality that I've often talked about, and that the duality of wonder and fear. Our first technology, I would argue, is fire. And fire was transformative to humanity. It allowed us to stay up at night. It allowed us to move around. It allowed us to heat. It allowed us to eat meat that was cooked, that provided protein to grow our brain. It was truly transformative. But fire also could destroy our house. It could burn it down. So there was a duality of wonder and fear. That same duality exists today for fire. Fire heats our house and cooks our food, but it's also one of the leading causes of personal and industrial destruction in the world today. So I think that duality is a fundamental problem with the integration of technology into our lives. The airplane, same thing. It was scary as heck, but it was cool. The driverless car, coolest thing around, but I'm really reluctant to get in and have it take me to the airport. It's a little bit much, but it still lives in that domain of wonder and fear. And finally, artificial intelligence, which I believe is the linchpin to unleashing data, is the same thing. Our vision of artificial intelligence is one of absolute wonder, but we are informed by the dystopian reality that's pushed forward by Hollywood. Let's face it, most of our understanding of the dystopian perspective of robotics and artificial intelligence is really not an academic perspective, but one driven by actors in movie scripts.
Thank you. Thank you, John. Just maybe going into the current events right now, and also based on your future or forward-thinking perspective,
Mm-hmm.
John, how do you think that the COVID pandemic has affected the use of data and digital solutions in healthcare? And which of these do you think are temporary, and which do you think will persist?
We talk about innovation and the adoption of innovation, not as a linear event. So innovation, as much as people like to think that innovation is incremental, it's actually not. Adoption is incremental, but innovation comes at bursts of wisdom, bursts of insight, and bursts of transformation. Just think back at the dinosaurs and how their world came tumbling down on the basis of one event. And in a way, COVID is that asteroid. COVID was an event that the former professor at Harvard, Stephen Jay Gould, refers to as punctuated equilibrium. In other words, we have a stable environment and then something happened. COVID was the thing, was the something. And I believe that it pushed us forward in a technological perspective, but the more I look at the data, the more I'm concerned that it was not truly one of adoption. In other words, we did it because we had to, not because we want to. And I believe that that's a real important insight. And I'll cite telemedicine as an example. Most of the papers, the newspaper articles, the pundits say that telemedicine was born because of COVID, and that it has now gained a foothold into reality. Well, as I begin to look at the data sets, and a lot of the data sets go back 5 months, they end around the summer, but the data that goes through Q4 in 2021 shows that the use of telemedicine has actually gone down, and in some instances, it's gone down back to baseline. So what's happening here? The introduction of technology mediated by an event, that's the punctuated equilibrium, has to live hand in glove with the adoption. And I don't see it happening. I think that in many ways, people are clinging to that old convention. So I think the takeaway here is that technology is coming at hand, but there are still a lot of social, functional, and financial concerns that are a significant impediment. So have we turned the corner on technology because of COVID? Absolutely not. And it's dangerous to think that we have.
I have to agree with John here. And I've seen a similar situation actually even back home, where we had the telemedicine furor. We had like hundreds, like literally went to, imagine a small island, went to hundreds of thousands of episodes. But then at some point, people kind of went back to their old way of doing things. So I actually can confirm that I've seen this trend. Then again, though, I still think that it was beneficial to set up the digital infrastructure and the digital way of thinking. That means that people now realize, Eureka, now I can use the technology. Now I have the infrastructure in place. So if we need to scale up, even if it is scaled up slowly and steadily with a good communication strategy and a good, even kind of, I would even say, trust strategy, where we focus on how we're going to build trust. I think we need to do many more of those trust strategies around, like even if they're internal documents, but how are we going to build trust back to the people, especially in digital solutions? And especially at times where they can get disappointed quite quickly because of all the emotions that are happening around. So that is really one thing that I would like to build on John's excellent contribution.
I'm going to jump in and follow up on that. Isn't it interesting, Stefan, that you cited as the tool for advancement of technology, not the user interface, not interoperability, but the human connection of trust?
Yeah.
And I think that's a very, very interesting dynamic that has to be looked at as a multifactorial realization of that. Look, I believe that that people have to try it. They have to do a telemedicine visit and recognize the advantages, not only the clinical advantages, but just the convenience and the time saved and the money saved. And I think they'll begin to develop those relationships with telemedicine and not just those cold-hearted technological ideas.
Yeah, yeah. Maria, if I may, just one last comment.
Please.
Like even for example, something as simple as a digital certificate. Now people realize that if they want, there is a whole infrastructure available for that. The digital COVID certificate, for example, and the vaccine certificates. We still travel to many different countries using the yellow book. I remember I traveled to one country and I had to actually do one to actually be recognized in another country. But now we can use our phone. And now that we've tried it and tested it and went through all the hurdles, I mean, I was working with my colleagues here to help people get their vaccine certificates. Something as simple as this. But that communication and that trust that you develop at helping people, I even had someone calling me from France. Listen, help me to get my digital vaccine certificate because I can't enter the hotel. But once you win them over, because you make yourself open and you develop a workforce which is open, then success is on the way.
If I would like to comment on the point John took up, which was that the use of telemedicine. We have to remember that telemedicine was, of course, born before COVID, so it was existing. But the COVID propelled it into kind of a completely new level. And I think the big question where we don't yet know the answer is that whether people would like to go back to the old normal, or can we drive development towards a new normal, where this telemedicine is something much more important role than it used to be in the past. And I think that the two things you mentioned are crucial: trust and confidence, convenience. That if people find it trustworthy and convenient, they will use it. And I think that it's too early to tell yet what is the final outcome. But as a policymaker, I know many policymakers now who are trying to make sure that we are not going back to the old normal, but we are going to the new normal. And we have to, in a sense, to go to that. The COVID certificate, which Stefan spoke about, that's a very interesting thing, because it's a digitalized certificate, which was set up by the European Union cooperation. And interestingly, it is used by 27 member states, but beyond that, many non-member states also. So, and that all the trust between the member states and the technology, they were put together in a record speed. There's a committee called the European Health Network, which is the member state representatives come together to agree on this. And it has really been an enormously successful thing to do. Because, of course, the other scenario was that each and every member state or region have their own certificate, which are not applicable in other countries.
I think that Pandora's box has been opened in this discussion, so I'm going to jump in. Telemedicine is older than I am. Telemedicine is the use of the telephone. I remember my mom calling the doctor when I had another earache, and the doctor would say, okay, it's another earache, and then I'd get my dose of ampicillin over the phone, and that was functionally a telemedicine visit. The sad reality is that that's the same thing today. There has been no evolution of telemedicine. Steve Jobs said it very, very interestingly. He said, in the early days of television, it was nothing new, but just the old radio show with a camera in front of it. And that's what we've done. We've taken the office visit and combined it with a Zoom call. And we expect that to be the new telemedicine when it's nothing really new. The challenge for us is that we need to leverage existing technology to reinvent telemedicine to telemedicine 2.0. And there are lots of opportunities to leverage existing technology to make it work. And here's the key takeaway. It's really not about innovation. It's about implementation. All the technology is available today. We just have to use it.
Actually, that's a great segue to our next question that was going to Stefan. So you are a specialist in public health medicine, and you're a professional seeking to create transformative and effective change. And you talked a little bit about trust and other elements, but we wanted to understand a little bit better, what do you think are the necessary elements that countries need to consider in strategizing and implementing successful mechanisms that improve the use of data and digital solutions in healthcare?
Oh, quite a question. But if I had to start from somewhere, I would make sure that I encourage countries to separate data from information systems. Once they do that, then they can pretty much rule the health data space, simply because the data can move to an information system, to a different one, which looks better, which works better, which functions better, which is available across devices. And so once that is done, that step is taken, even like separating even from a legacy system, for example, because we still struggle with many legacy systems. And this is not just in healthcare, mind you. If we just look at banking, we see that they are even using systems based on COBOL. So let's not always put healthcare down. We're doing quite a lot in healthcare. But if we if we don't do that, then we're going to struggle. So that's the first step, separating the data from the systems. Then once you do that, then you can use the data for artificial intelligence. You can use the data to build other systems, to learn from that data and make an information system even stronger. For example, you can have a specific information system with a specific piece of information. And then once you separate the data from another system and you join it up, you can, make secondary use of data, as Stefani mentioned before. So there are all these different elements, and that's like critical. The other thing then is to focus really and truly on the user experience and communication. I think in digital health, we don't invest enough in user experience and in communication. Even as simple, like let's say if you're gonna set up a digital health team, make sure there is a marketing consultant, or make sure there is a marketing professional, make sure there's a communication professional who will sit down and write that blessed email that needs to be sent out to gain the confidence of the stakeholders, not being stuck doing development tasks, for example, because you're dealing with this and that. That's important, but you need someone to communicate, to talk to the people. And if you don't invest in that, then you're gonna struggle. Where projects are gonna go delay. Sometimes you even need someone to talk to the people, like negotiate, like, listen, why don't you use this feature? It's available there. Let's make the best use out of it. And then they come up with another obstacle, and then you come back with another solution. So having this solution-oriented approach with a focus on user experience and communication, investing human resources and time and technology, even that's critical. Mm-hmm. And I would even mention education. So John alluded to this before. It's useless having the best and most advanced genomic sequencing when you're a doctor that has no idea how to use it. No idea.
Yep.
Not even like to process a text file. For example, I have a text file with my genomic data, but does my doctor have any idea how to use it? You know, that's like, so we really need to, you know, integrate data science and understanding of data science and digital health deeply into the health professionals' education. It can't be left out anymore.
You touch on a kernel of truth here that I think is so important. Physicians are not trained to communicate.
Yeah.
They're not. If someone wants to talk to me about arthritis, I will turn off because that's a disease of my grandmother. But if someone talks to me about bone health, I have an interest as a runner. So it's so important that the language, the lexicon of a condition, the lexicon of technology, the lexicon of a brand is written in a way that sticks to the roof of your customer's brain. And, you know, if I were to ask a physician about, I don't know, a cephalosporin antibiotic, she would tell me that it has a beta-lactam ring, it has good GI tolerability, it has nice broad spectrum coverage, including strep pneumoniae. You know, I would get a bundle of benefits. But if I asked someone about Volvo as the car, I would get a one-word answer. It's safe. Because that single-minded point of difference engages me and allows the patient or the customer to say the magic words. And those magic words are, tell me more. That's the essence of the dialogue. And I think that marketers in digital health startups don't understand this. Clinicians certainly don't. And that's a real tragedy because the brilliance of an idea is lost in lackluster communication.
Stefan, just a quick follow-up question. I don't know if you can share with us a little bit more around successful strategies or mechanisms that has led to improved data and digital solutions in healthcare, maybe some examples, and what made it successful in your opinion?
Actually, I have one good example for you. Let's assume that you fall ill and you need a medicine. How you will get that medicine? Let's assume that your illness is such that it can be diagnosed relatively easily over the internet line. And that's actually nowadays reality in the country I'm now living in, that you can visit the doctor remotely. You get a diagnosis, you get a prescription. The prescription is sent into a national system. Then you can visit the pharmacy digitally, and the pharmacy has a legal obligation to give you instructions how to use the medicine. But that's done over the chat. And then the pharmacy also then goes to this national system, takes your prescription, and if you are not in a hurry, you can even get your medicine mailed to you. But of course, if you are in a hurry, then you can say that, okay, I come and pick it up from the nearest pharmacy. This is a digitalized e-prescription system, which is already functional in Finland for several years. And it truly, it's a good example how the digital systems are combined so that the data can move from the patient to the doctor, from doctor to the pharmacy, and then again back to the patient. And it also shows the convenience that basically the only thing you need to do is that you need to go and pick up your pill from somewhere, because that's you cannot yet send that over the internet. That's a national system which is fully functional. And actually, it was some 5 years ago when in Finland they prohibited writing paper prescriptions. You can only do that if there is a power cut or a special circumstance. I mean, you have to justify why you're doing a paper prescription. All the other prescriptions are E. But then let's say that I got my, I have a chronic disease and I got my medicine, but then I'm traveling to Estonia, the neighboring country, and I realized that my medicines are, I don't have my medicines anymore, or I forgot them to Helsinki. But now Finland and Estonia, under this European My Health at EU system, they have an agreement that I can go to any pharmacy in Estonia and say, I have an e-prescription in Finland, in another country. And then the Estonian pharmacy can go and pick that up. And so there is this cross-border system also. So I think that the lesson is that, the lesson and why it worked at national level, first of all, I must say that not all doctors were happy to start using e-prescriptions. So there was this order that you are not anymore allowed to do that. Now everybody's happy with that. And it also needed kind of a national backbone, a national system which works and which works all over the country, not only in one pharmacy or that pharmacy, but it works all over the country. And then the added benefit is that if you can extend this system cross-organizational boundaries, be they national borders, or I think that in the US, you might have organizational boundaries between hospital chains or pharmacy chains, that if you can cross over those boundaries also, then it's even more useful for people. And in Europe, this system, My Health at EU, is exactly doing that, is that how these patient data can travel across borders. So when you're traveling to Spain for your holiday, you are still covered by the services. What was interesting that in 2018, I met Didi Davis, who is a vice president for informatics and interoperability at Sequoia project in the US. And I understood that the Sequoia project is trying to make sure that the hospital chains are communicating with each other. In the same way as in Europe, the My Health at EU is trying to make sure that our national systems are communicating across borders. And what was even more interesting is that we were using the same technical standards, IHE standards, to overcome these borders. So I think that there are good examples, practical examples, which show benefits for professionals, patients, and the system.
Thank you, Tapani. Great example on that cross collaboration and communication to improve access. Stefan, I don't know if you have any examples yourself to share in terms of improving data, the use of data and digital solutions.
So I think if I had to start off somewhere, I would naturally go to the UK. So the UK did quite a lot. They were doing the topo review. They were doing a lot of work. But I see it. Mostly, sometimes it's not a document that really shows what is a success. But what shows success really and truly is the actions and the ecosystem that is built. And it's really clear that in the UK, you see, for example, Tony Young, who's the National Clinical Lead for Innovation at NHS England. He's on LinkedIn all the time, communicating and sharing the Clinical Entrepreneur Program. That's something simple. You see the people interacting and trying to reach out for ideas actively, I would even say. So that's the kind of approach we're seeing there. But if you had to also look from a global level, you know that the WHO just recently came up with Global Digital Health Strategy. And they came up with a number of blueprints and documents surrounding that to build up on that knowledge. So you can see, even if you analyze documents at WHO, you see that there's an incremental increase. First, they start off with the classification of digital intervention. And now they came up with a document on building a digital infrastructure. They coined a new term because of all of what's happening here. And literally, if you see that document, you there have a blueprint, an architect's plan, let's say. So imagine we have architects, they do the plan for now. If someone wants to start from scratch, they can get that document from WHO. They analyze it. They see the gaps that they have, and they bring it all together. Now there is no excuse anymore, really. But if you have this blueprint, you have the communication aspects, and you see people interacting, engaging, and reaching out. Even, for example, something as simple as this, that having health professionals, that instead of them having to work a full clinic, they work 3 days clinical and 2 days project management. Just the few hours spent on project management can be transformational for a whole organization.
So I'm going to follow up on Stefan's comments. Something that I found very interesting. One is we're moving from brick and mortar to click and mortar. And I think that's a very important change. And buried in this dynamic is something that we often don't talk about. And that is the powerful role of the pharmacist. When we talk about these advantages of having an e-script going through the pharmacist, I believe that we will see the technological empowerment of clinicians and patients mediated by that common point, by the pharmacist. My mom had 10 doctors, but she only had 1 pharmacist. So I think that we have to keep in mind that it's going to shift away from the physicians. Now that's going to make them nervous, but we're going to empower allied health professionals to take on new roles, and their technical and cognitive abilities will be enhanced by technology. So, it's not brick and mortar, it's click and mortar. I think that's a real interesting change, and it's very powerful. I wonder if we should change, Tapani, instead of calling it an e-prescription, maybe we call it a global script or a G script or something that actually changes the language that can change the thinking.
John, actually I have to disagree with you. We should just call it a prescription. It's simply digital. That's the kind of mentality that we need to build towards. That by default, it's digital.
Yeah.
You know,
people say that all the time. They say that
I know.
It's not digital health, it's health. And I like it and I don't like it. I'll give you one example. In the context of very sophisticated financial talk and electric vehicles, everyone, some people say that it's an EV, but ultimately it's really just going to become a V, right? The Tesla car is going to become a car. But I'm not sure we're there yet. When I talk about an EV, it's a very, very specific and focused discussion. If I just say V, if I just say car, it's more complicated. Is the world, is the patient, and is the clinician ready to make that transfer? So it's just a script. It's not digital health, it's health. I think that may be a premature transition that will actually hurt the evolution of the adoption.
I fully agree with you. And then of course in Finland, because you only have prescriptions and they are electronic always. Exceptionally, they can be on paper. And in the same way, I think that in many other countries too, that when you say, I go to bank, of course, you're not going to leave your home. You're just opening your computer. So, but it takes some time because during the period when you still have the traditional system and new system, then you make the distinction between them. But there was actually one thing that you, John, mentioned about this role of pharmacists and the changing role of different healthcare professionals. And this is absolutely important thing. And it's also one of the most difficult things, because in any organization, and especially in healthcare, which is by definition quite conservative organization, any changes in roles and responsibilities, they are not immediately adopted. So you can imagine that if you, for example, if you try to transfer task from a doctor to nurse, that's not a kind of a thing you do immediately. It's much more complicated. This transformation in healthcare is much more than transformation in digital. And actually, Stefan mentioned at the beginning that he has been working in the European Public Health Association. It's a great organization. I know it also very well. And of course, there we emphasizing that we are speaking about healthcare. We are not speaking about digital healthcare. I think that digitalization is coming to help the healthcare to do its task. And so the digitalization in healthcare is a tool to achieve something. The more important thing is the healthcare itself. It's only done different ways.
You know, Tapani, you say something that's very interesting. And I want to push on it in the other direction. We talk about the transfer of clinical skills, roles, and responsibilities to the nurse, but it's becoming more complicated in the context of technology. So here's the question. Who is the smartest person in the exam room, in the hospital, in the patient's room? We know that that answer is the doctor. It's always the doctor. From an educational perspective, cognitively, physicians tend to be the smartest person in the room. I give you that. However, tomorrow, and maybe even sometimes today, the smartest person in the room is the computer. And that is a point of controversy, because I believe that the cognitive heavy lifting of clinical practice will be shifted from the physician to the computer. The differential diagnosis, the availability of clinical trials, a rapid and very, very deep analysis of things like bloods, labs, and even DNA will be done by technology. Now, what happens? The physician flips out, because we live in a hierarchy. And there is a psychodynamic where there's a pecking order. We know that. Go on rounds and watch the way people walk into a room. Look at the chief of medicine versus the intern versus the medical student. There is a hierarchy. There's a hegemony. So I think that as we transfer responsibilities down to the nurse, to the pharmacist, to the respiratory therapist, we're also going to be transferring those responsibilities up to technology. And that is going to be a very, very tricky path forward.
I think that you are touching upon a very important thing indeed, that we are transferring responsibilities to different persons. I don't know if it's up or down or horizontally, but also that in healthcare, it's not only always a question about who is the smartest person. It's a question also who is the wisest person.
Okay.
Because when you go to a doctor or nurse or physiotherapist or whatever, you are hoping to meet a person who understands you and who takes your psychological character into account. And sometimes whether that person is the wisest or the most knowledgeable in the area is not the key point. That if you have a simple problem, then you probably want to go to a doctor who understands you well and treats you well, but only if you have a very rare problem, something kind of extraordinarily difficult, then you would like to have a kind of a top specialist. And that is also then that in healthcare, many of these things which are now done, carried out by doctors or by nurses or physiotherapists, whoever, there could be other models too. So when we are thinking about digitalization of healthcare, we have to think about the whole business model there, that how healthcare is delivered, how treatment is delivered to a patient, how we create health.
Just to follow up on what you said before, John, especially about the smartest person in the room, which really struck me. I think at the end of the day, it's all about the locus of power. That means that the doctor has to be willing to lose that power slightly so that he gains a much bigger power. And everyone gains that much bigger power, which is the power of a network of computers and doctors, because people kind of forget that the knowledge that comes from a computer didn't happen automatically, didn't magically absorb from the air. It actually was inputted by a lot of health professionals into systems. And I think once the doctors and health professionals realize they lose a little bit of the locus of control. It comes back to the middle, to the computer. But in return, they have an access to a network of worldwide doctors. Imagine that there will be 1,000 doctors' knowledge in one room. I think once that mental shift is done, then magic happens, you know. So that would be to build up really on what you've brought up. Thanks.
I think that you're spot on, and I think that sort of pushes into the philosophical perspective of having 1,000 clinicians, 1,000 brains in the room. But let's go back to the very beginning of our discussion, and that was that the ability to assimilate the data that's coming at us as a clinician is impossible. We can't do it. So we have to rely on technology. You know, the traditional dynamic, when the wife comes home from the pediatrician's office, the husband will say, "What did the doctor say?" Right? That transfer, that's going to change. The question is, what did the computer say? Now, before you yell at me, I want to finish that sentence because there's a comma there, not a period. The question is, what did the computer say, comma, what did the doctor do? So we're not removing the clinician from care, we're optimizing the physician's role in care. What's the biggest complaint physicians have today? Technology takes me away from my patient. If an alien were to land in an exam room, the alien would think that the patient is the computer screen, because that's where the doctor spends most of his or her time, not facing the patient. But isn't it interesting, if we could shift the cognitive heavy lifting to technology, we will allow the clinician to engage in a more richer and more human experience. And that could be transformative.
So I think that's a great segue. I know we're going into 10 and we want to get into challenges. And I think we're touching on some of these. So maybe we could talk a little bit about, maybe the first question was to Tapani, to Tapani, in terms of what are the major barriers to truly advancing the use of data and digital solutions in healthcare, and how are these barriers also affecting access to quality healthcare? So we've touched a little bit upon that, but maybe you can expand on that.
Thank you. These barriers, of course, you can have a look at them at very different levels. One of the, I think that John just mentioned that how much the healthcare professionals need to spend time with the systems. Recording the data into the system, it's very time consuming. But of course, if that recording of data is not done properly, we don't have quality data in a system. And if we don't have quality data in a system, of course, the whole system, the quality of all what's coming out of that is much less good. So, but this is a very practical problem, and I think that the technological development will solve that. But it might be perhaps if you have a look at these barriers, it's useful to analyze using these 4 elements of interoperability. The first level of interoperability is legal interoperability. And here that how the different countries' laws are working together. And that's where the European Union is very much putting effort into trying to make sure that this interoperability at legal level happens. And it's really a political process. There's a lot of progress there, but there are also lots of challenges because member states here in Europe, they want to keep their own specific regulations. This is also related to the use of artificial intelligence. For example, how much can we use it in clinical care? What is the responsibility of doctors there, for example? Or can you use artificial intelligence cross borders? That's the first thing. The second thing is organizational interoperability. Can organizations agree to work together? So, for example, these pharmacies in Estonia, do they agree on the practical arrangements, how to work with the Finnish things, and how the cultures and other things between the organizations work? The third level of interoperability, which is actually probably the easiest of all of them, is technological. How can we make the computers talk to each other? that used to be a major problem when I started my career in digital in the 70s and early 80s. That was a big problem. Today, we have actually overcome that a lot. The fourth interoperability problem and challenge, it's perhaps the most difficult to answer, and that's semantic. What do we mean by words? The World Health Organization has done enormously important work with the international classification of diseases, because there we try to, in a sense, that what is meant by a certain thing like myocardial infarctions, what does that mean? But the semantic interoperability goes much beyond a simple diagnosis. How do we define things? And that, for example, and it is something you cannot solve by politicians. You cannot solve it. It's heavy work where the experts need to try to understand each other and come up with a concept so that they see. So using these 4 levels, I think that you can pretty much map the challenges and to see where they are. But the bottom line is that I think that the technological part is the easiest.
Great.
Thank you, Tapani. Stefan, we have a similar question for you as well in terms of key challenges to developing or implementing policies that enable the use of data and digital solutions in healthcare.
I think really and truly, one of the biggest challenges that there is in any digital health implementation, really and truly, is the conflict between political priorities and technical priorities. In fact, COVID really showed that when there is alignment in these 2 priorities, let's say the digital health technical priorities and the political priorities, magic happens. You bring down mountains. You make a mountain. You make it like flat. Now, even the resources, they are thrown your way. You know, it's a whole difference. Once you get, and I'm not talking political in the big P, where you're talking about just, the higher level, but also the small P. That means the small politics in between the different organizations, even sometimes between different ministries, for example, or between different, companies who have the same target audience, for example. Even if you just look at electronic health records, once Epic and Cerner saw the possibility of sharing data and how it enables and even grows their businesses, all of a sudden, you've seen like this shift in mentality. So when they have this, then what happens as a result of this? There is trust and communication developed. And then because of this, there's like this positive cycle happening where you have like a sharing of skilled human resources. So you have like this, and because of all of this, because the alignment in political and technical priorities happens, then really you create magic there. I couldn't see it and time again, even when I was doing my master's in health informatics, many times the politics came in. Mm-hmm. Even just a change in government, okay, we don't agree with what the previous government did, let's do it all over again. It happens all the time. So that's why, for example, I believe in autonomous bodies which direct digital health strategy, or even, for example, something as simple as a public health institute, which is autonomous, which has the right to publish its own material. That's so important,
Thank you, Stefan. So I guess our last question goes to John. So we've talked a little bit about the lack of prioritization, the interoperability challenges, but based on your strategic understanding, what is needed to overcome some of these challenges, and how can different stakeholders, including the private sector, the private healthcare industry, help to address such challenges?
Let's unpack that a little bit. I'm going to take a step back. Stefan, exactly correct. When political issues can align with technological potentialities, magic does happen. But I want to go back and talk about those political issues, because beyond governments, beyond societies, we have political issues in the context of clinical medicine today. Medical centers. One center has a POV that is different from others. There's a hierarchy in medicine. So I think that this whole notion of collaboration, people like to say that collaboration is the new competitive advantage. I agree. I think that's very true. Having 1,000 brains in the exam room is a wonderful thing. But the notion of collaboration and consensus is a very dangerous construct today. In our increasingly socialized and politicalized world, we look at consensus as taking an average. Let's use an example. Stefan wants a white house and I want a red house. So let's come up with a consensus solution. Let's make a pink house. Well, clearly that's an intellectual average, but it's a horrible solution. And I think oftentimes we see that decisions are made in the context of some sort of equitable contribution. And the equitable contribution is fine, but the solution has to align to something that is optimal from a cognitive perspective. And that's where I think we get into a lot of trouble, that we do a lot of intellectual averaging. And that's a problem. So number one, I think that we need to look at the nature of engagement and collaboration. Number two, we live in a tricky world. Remember earlier we talked about how it took 67 years for the airline industry to reach 50 million customers, but Pokemon Go did it in 19 days. That's called exponential innovation. Speed is something that is antithetical to progress in many instances. So speed is a very tricky thing, and that impacts many of our decisions. Harvard Business School asked CEOs, what is your advantage? What's your competitive advantage? And they largely said speed. And I think we can extrapolate that to clinical medicine. If I have a patient who has a stroke, or if I have a patient with an MI, their outcome is defined by speed. Speed to diagnosis, speed to therapeutic intervention. But those CEOs were asked another question. The question was, what keeps you up at night? And they answered with the same word, speed. And I think clinical medicine is very similar, that the speed of change is disruptive to the cognitive, academic, well-informed perspective. So that flips people out. Now, the other side of that is that when we look at exponential change, the early part of that curve, the famous exponential curve, is actually below linear change. Now, let's just take a moment and try to imagine that. The early part of exponential change is not as good as linear growth. The part of the curve is underneath that. So if I'm a businessman and after 3 or 4 or 5 or 6 months, my exponential plan isn't doing as well as linear growth, my boss, my administrator might say, your plan isn't working. And conventional wisdom says, fail fast. That's a problem. We're seeing that in clinical practice. They're saying, well, that newfangled widget, it's not working, let's fail, let's get out of here. It's like the Apple Newton. The Apple Newton failed because there was no connectivity. It failed because there was no memory in the device. The idea was brilliant. The idea was great, and it came to life as our smartphone today. So failing fast in the context of exponential change is problematic. So there are a lot of functional issues that arise in business and in medicine that make those decisions uncomfortable. And I think that clinicians don't like to live in a world of uncomfortable. In the final analysis, what a doctor likes is not new, but the same, but a little better. A physician doesn't want a new untested antibiotic. You know what she wants? She wants a better beta-lactam, a better cephalosporin that has advanced spectrum of coverage with better GI tolerability. That's the nature of clinical advancement, the same but better. But now we're offering them something that's completely different. And that is problematic.
Here, this is the second part of our forum, and here we want to talk a little bit about opportunities to advance policies that improve the use of data and digital solutions in healthcare. And specifically, what we want to understand, again, based on your perspectives and your experience and your insights, what opportunities exist to advance policies that increase access to innovation in healthcare, and what opportunities exist to establish partnerships and interact with policymakers and other key stakeholders. So we've talked a little bit about collaborations and partnerships, and some of the things we need to do to improve that. So we'd like to expand on that. So with that, our first question goes to John. And again, here continuing with your forward-thinking focus, how do you see the use of data and digital health solutions evolving in the next 15 or so years? In other words, what do you think are the opportunities, or what would you hope for in a future world in terms of use of data and digital health?
Boy, when you mention 15 years, I would argue that our century, the 21st century, really didn't even begin in the year 2000. Nothing happened in the year 2000, actually. Y2K was supposed to happen, but Y2K didn't happen. Around 2000, 2006 or 7, we saw the emergence of the smartphone, which I think really is kind of the tool of transformation that really shocked us into a new reality. And in a way, I think that we are at a unique point in human history today. I want to jump back 100 years and ask people, what happened in the year 1900? And the answer is nothing. Nothing really happened. But when you look at 1915, 1917, 1920, we saw interesting things. We saw the emergence of the airplane. We saw the emergence of vaccinations. We saw the emergence of Spanish flu. We also saw the emergence of child labor laws. In other words, the century didn't begin in the beginning of the century. It began a little later. And I think we're seeing that now. We're seeing the advancement in technology that is really an inflection point in human history. So when we talk about 15 years, I'm almost afraid to tell you what's going to happen in 15 years. I think that we're going to see such a fundamental shift in consumer empowerment, in the evolution of data and the analysis of data. But I also think we'll see some interesting points of transformation. And I want to discuss those in the context of sort of the 4 touch points of transformation. And the first is digitization. Things are becoming more and more digitized. The X-ray is now functionally digitized in a PACS system, right? The digitization allows that technology to become dematerialized. In other words, it's smaller. Dematerialization allows it to become demonetized. So it becomes cheaper. And ultimately, demonetization will lead to the magic point of transformation, and that's democratization. So I think that's the path that's happening now. Now, where's it going to be? Let's take a look at some of the future ideas that exist today, some of the things that are transforming medicine. I think that imagine closing your eyes and imagine what an EKG machine looks like. It's that clunky white box that's on 4 wheels, and we push it around the hospital, or we push it into a patient's room. But in today's world, this is an EKG machine. This is a credit card device. It's from AliveCor. It was just launched yesterday. It does a 2-lead EKG. That EKG is pushed up to the cloud and interpreted through AI. So the interesting thing about this idea is that it started with an electrophysiologist. It started with a clinician, Dave Albert. It made its way through technological and financial facilitation. And now, where does it live? It lives on Amazon. It lives in the domain of the patient. So I think that's going to be a future aspect where patients become active in their care and that tools are no longer in the hands of the physician. I'll do one more. What the heck is this thing? What is it? Is a smartphone? Maybe it's a battery charger. It's a stethoscope, right? It's a stethoscope. The interesting thing about this stethoscope is that it creates a sound that can be synced with our phone and be part of the medical record. Now anybody who's ever worked with a stethoscope knows what its purpose is. Its purpose is to identify the doctor in the room, right? And all the crazy things that people hear through a stethoscope, that 1/6 murmur or that S3 gallop sound, is largely a rumor. Very, very difficult to hear. And oftentimes the cardiologist might hear it, then magically the medical student hears it and writes it down in the chart. But this is an opportunity where the stethoscope now becomes digitized. And by using the stethoscope and a single lead EKG, we combine these two and we can actually measure contractility, cardiac contractility. So that allows patients with congestive heart failure to use this type of technology. Data just published yesterday. So what happened? The stethoscope, which was once the domain of the clinician, worn reverently around his or her neck like a prayer shawl, now lives in the hands of the 68-year-old man with congestive heart failure. And he uses it to measure his heart rate, look for atrial fibrillation, and to measure contractility. So I think we're going to see very, very interesting and fundamental changes. Interestingly, many of them exist today, but the adoption curve is such that it's going to take 5 years to catch on.
Thank you. Thank you for that. Tapani, next question. As someone with quite extensive experience in health policy implementation efforts that directly impact access issues, and specifically regarding access to quality healthcare, how do you see the role of data and digital health solutions evolving? And what do you think are the opportunities, or like John's questions, what would you hope for in a future world in terms of data, digital health, and access to quality healthcare?
Usually my advice is that when people ask that how to imagine the future, I say that read science fiction, because those what the authors, they can imagine, somebody will implement at some point of time. So if you read Jules Verne from the 1980s, you see that how he imagined things that were to come. But actually, I would like, in a sense, to analyze this a little bit, this future a bit more. Patients come in very many shapes. You have patients who have an acute problem, which they are maybe working age people who have an acute problem, which is relatively easy to fix. And then you fix the problem, the patient recovers, and it's over. And digitalization may offer a lot of help here over the telemedicine things, for example. Then you have patients who have chronic problems, which may be of any age, and where the problem continues over a long span of time, and the patient needs a lot of monitoring, perhaps, like in diabetes. And that is something that the patient can do himself or herself if there are adequate tools for that. And there, for example, the relationship between the patient and the caring people, nurse and doctor, it's very different in this acute case. Then you can have a very complicated problem, like a rare disease, where you really need to pool the knowledge from many people and from a community. And then perhaps then the most widespread issue in healthcare is something which we normally don't think so much. It's people who are getting old and frail and multimorbid. And there, of course, the digitalization will help there also. But there, the aim is not anymore to cure these people, but it's to care for them and to take them forward. So I think that when we are thinking about it, the digitalization will not be a silver bullet for everything, but it will have a different role in different types of life situations or health situations. And in some situations, it will actually then change completely how it is done. Like in the chronic disease, I do believe that, for example, the patient empowerment, there will be enormously important part of people taking care of themselves. But if you have an acute problem which occurs to you only once in your lifetime, there's no point of trying you to train for all that. The second aspect, so this is in a healthcare, practical healthcare, what's happening. The second thing, which is in this development and research, where because enormous changes have happened in treatment. Some of them have been spectacular breakthroughs, but many of them have been these incremental improvements. But there, I think that one of the things which will be important is that the data and digital will enable lots of new research, and through that we can, if we have reliable data from healthcare, we can do real world data studies, for example, which will help us to analyze the effectiveness of treatments or medicines or ways, treatment protocols. But then the last section of how the future will look like, we have touched upon some of those elements. I listed as my first point is that the digitalization and data in that digitalization, where it will have a lot of influence, is communication between the healthcare and the patient and the citizens. We see that already in those national healthcare, in those systems where you can access your own data, like in the Finnish backbone system, where you can actually go and see whatever is written about you wherever you have gone. The second thing is that the digitalization will probably ease lots of bureaucratic processes, from the simple thing of booking your visit to a doctor going digital, into much more than complicated system where the development of remote consultations and telemedicine will enable people, for example, from rural areas to have access to a psychiatrist or skin dermatologist, because those are things which can be done easily remotely. And then one of the things which will, I believe, be very important, and it's related to this fact that we are all living longer, and many of us then, when getting very old, we need to have more help. The smart home, all different kind of smart systems at home, which help you to stay at home, because that's what most people at the end would like, to stay as long as possible. And then one of the things which is still emerging, but I do believe that there's a lot of potential, are digital therapeutics, where you can use digitalized system apps for different treatments. There are lots of different facets, but there's no one silver bullet curing the cancer, which is actually a range of diseases.
Thank you, Tapani. Just continuing just quickly on your perspective, is how could we make the use of data and digital health solutions the tipping point or the route to more equitable healthcare systems. I think you mentioned a little bit accessibility, but maybe if you could expand on that.
I think that we need to, of course, invest in development. It is very clear money is needed to make things happen, but that is not the only part. And myself, I haven't been a public sector administrator all my life. I see that the value of legislation in enabling things. We have been, for example, discussing during this panel about artificial intelligence and how it can revolutionize treatment, but it's only happening if the legislation allows that. And so therefore we need to have proper legislation in place, which is enabling the use of digital, enables use of data, enables use of artificial intelligence. A simple example of that was that in Germany, having remote consultation was prohibited before the COVID. They had a health minister, health minister, who was very far-sighted, or forward-looking. He actually changed the law before the COVID, which enabled remote consultation in Germany. And that legislation was in place at the time when COVID started. Had that change not been made in Germany before COVID, they had awful difficulties when the COVID hit, and the patient needed to have remote consultation. So we need to fix the legislative machinery so that it is enabling and promoting this digitalization. One of the things which is specifically about data then, which is happening in the European Union, is that the Commission is about to propose, hopefully first part of this year, a proposal whose name is the European Health Data Space, which would seek to enable and incentivize use of data cross-border in Europe. It cannot touch what is happening at national level, but as I said earlier, if something happens at EU level, then it stimulates the national developments too. In this proposal, they are likely to have 4 pillars. One which is about the health data used in treatment. The second will be the health data used in research and other secondary purposes. The third pillar will be enabling the cross-border telemedicine in Europe, because it's still kind of an unregulated partly, which is preventing people from using it. If you don't know what's going to happen legally, you're bound to be careful and not to do that. And the fourth pillar will be on medical or health use of artificial intelligence. And so my advice is that once that proposal comes out, it will definitely it will define how the landscape will look in Europe, and we have seen with the European General Data Protection Regulation, it has effects well beyond the boundaries of the Union.
Thank you, Tapani. We want to move on maybe to Stefan. So as someone seeking to empower healthcare professionals to develop and diffuse, you mentioned earlier on in the panel the need to diffuse user-centric solutions for healthcare. We wanted to understand from you, how can the broader ecosystem or even regulatory environment be improved to enable the use of data and digital health solutions? And then maybe touching on some vulnerable communities and what kinds of innovations or innovative policies are needed for countries to improve the use of data and digital health solutions.
I think, and I want to continue a bit on what Tapani said. Germany is a really good case study. And if you see, they had the DIGA Act, which was the act which enabled digital therapeutics. Mm-hmm. And even in that act itself, the framework, the regulatory framework also takes into consideration startups coming up with new ideas, and they're given 1 year to prove the evidence base. I mean, it's still getting started, still a work in progress. And I can see that there aren't hundreds of apps. There are maybe 45 to 60. But I can see a constant flow of learning. That means that first, for example, they only enabled digital prescriptions. And funnily enough, they got a lot of feedback to even set up a simple paper prescription, believe it or not, for a digital therapeutic. But what does that paper prescription have? Have a simple QR code so that someone can grab his phone. I have to scan it. All right, very nice. And now, since we're all about QR codes, you've seen yourself, like just see the pandemic and certificates. Now there is that interaction. There's something tangible, something you can touch, which people, because people need something from a healthcare professional. They need an outcome. They need a prescription. They need something. They need a solution. And that bridge, that makes a huge difference. I mean, I've even seen it in Malta, where at first people didn't really take up. There was some challenges with the uptake of our MyHealth, which was our patient portal. But once there was a paper which enabled people to give consent to the doctor, all of a sudden the uptake went up. So sometimes using old technologies to enable new technologies is great. And one other way that I would like to propose is that the same way that we have community nursing, the same way that we have community professionals, we need to have community digital health professionals. Digital health professionals that they are saying that they have an office at their local health center or at their doctor or in a surgery, and they help people using digital health apps there and then. It could be like a 50-year-old who comes in. So how do I use this latest wearable? I mean, how can I use my Apple Watch? And that person shows him, listen, you know that you have an ECG function on your phone? Oh, wow, how do I use that? That human-to-human interaction. That is going to be a success factor if we manage that. And coupled with developing digital health literacy, we really have a magic combination there waiting for us. But to finalize as well, and even to bring the idea of data as well into the picture, in Malta, for example, we had the COVID results submission portal, where private providers submitted diagnostic tests in relation to COVID. And then, because of that, the data flowed from the private provider to public health. At first, it was being used, but it was only truly enabled when the regulatory framework was set in place. That yes, you need to submit through that portal. You need to do this, this, and this to get your COVID testing license even. All of a sudden, you had this enabling. And because of this now, we can develop data flows where the flow goes into our systems and keeps on going down the operational business chain, so to say. I hate to call it healthcare business, but in reality, we do have some similarities. So I have all of these things in place. And I fully agree that regulatory framework enables innovation. But then you need to make sure that it's not a one-way communication, it's a two-way communication. That means that regulatory framework, if need be, adapts accordingly, learns and listens. Because if it stays static, we're bound for failure.
Thank you, Stefan. We just want to follow up a little bit with you also in terms of what would you consider to be determinant factors or actions that are needed from different stakeholders like governments, industry, and key stakeholders to ensure the use of data and digital solutions? And you mentioned some regulations, but maybe if you have any ideal set of policies or a minimum set of policies that would enable this.
One big thing is that we have in our favor is that we need to first understand that digital technologies are a determinant of health. They are. If we keep on, putting this aside, we will struggle. And this is reflected on a lot of work done on the governing futures by the Lancet, and there's a specific commission actually which works on that. The Governing Futures 2030. They've done a lot of work on this. And this commission basically kind of made it very clear how important it is that we understand how digital work, we understand how digital will enable our lives, but at the same time, we need to be wary and we need to understand how it works so that we can get the most out of it. And once we understand that digital technologies are determinant of health, even the way we design health services will evolve and will transform. And that is the moment where we can truly enable, because we have social determinants of health, which are truly covered, but they kind of leave out the digital part of the equation. And now, which has become extremely obvious because of the pandemic, like extremely obvious, even something as simple, for example, through our system, for example, I was working with the COVID response team. And when in the COVID response team, you kind of realize that sometimes not everyone has an email address, something as simple as that. Mm-hmm. So that is something that we really need to address, and we need to empower and encourage people, to enable. And that's why the community outreach, all of these coming together to truly enable digital technologies in healthcare. Like that's really the combination, that making the human touch and getting the most out of those.
Thank you, Stefan. John, we have a question for you, a couple of last questions that go to you. So as an innovative strategist that has guided private sector companies and organizations and even governments through change dynamics, what do you think is, or what should be, the role of healthcare industry specifically in advancing the use of data and digital health solutions, and ultimately also supporting governments or health systems to improve access to quality healthcare for individuals and for communities?
I'm going to try to take that one step at a time, and I'm going to blame Stefan and Tapani for giving me too many things to think about here, because I think the ideas are overflowing and it's almost hard to corral them. But I think that we have to look at other industries, other success paths, particularly the financial industry that has had some great success in this dynamic. And if we really push to the future here, we're seeing the emergence through cryptocurrency and blockchain, this thing called DAOs. And a DAO is a decentralized autonomous organization. And the point I'm making here is that we're actually seeing a shift to decentralized aspects of care, that brick and mortar, that hospital, that office is becoming decentralized, and that evolution is autonomous in a very sort of care at a distance kind of dynamic. That's number one that I think is interesting. Number two is this idea of stage 0 disease. I think that we talk about prevention, but from my perspective, the path to prevention is really one of technology. And what I mean by that is that doing yoga and eating green leafy vegetables may have salubrious effects. It may be healthful, but in the final analysis, it's going to be the DNA analysis. It's going to be finding a abnormal blood chemistry or growth earlier and earlier and earlier. So my feeling is that the path to wellness, the path to longevity, is the notion of stage 0 disease. That's a conceptual idea. The problem is it's not real practical, because if you look at today, upwards of 47% of patients in the world do not have access to basic analytics. They don't have access. They don't have access to a CBC. So when we talk about these esoteric things like genomic analysis, let's just measure their white blood cells or measure their red blood cells. So access to diagnostics is extraordinarily deficient, almost half the globe. The other interesting thing is 2/3 of people around the world don't have access to imaging. So when we talk about finding a tumor or finding something early, Well, first of all, it's not finding the tumor, it's the patient finding the device, finding the technology. So I think that's another thing that's very, very important as a path forward. We have to develop access to these modalities and these devices. The third thing is this whole idea of, number one, there's innovation. Number two, there's finance, right? We need to get the money to infuse it. Number three, there's a regulatory path that needs to be traveled. And number four, there's the clinical construct. I'm taking the consumer out of it for now, the patient out of it. But this dynamic is a tremendous mishmash that is extraordinarily asynchronous. That the innovation happens before the regulatory change happens, or the money is there because it's a big idea, but the medical community will not embrace it. I think what we need to do is adopt a new level of synchrony. And I'm going to coin a phrase right on the fly, synchrovation. It's the notion of synchronization and innovation coming together. Synchrovation is the process by which a good idea can be inculcated into a system, whether that be financial or regulatory. So that's the other idea that I think is very important as we advance ideas. And finally, and the last one is completely philosophical. And as you've probably learned, that's where I'm most comfortable because I don't have to provide any data. But Alvin Toffler, who wrote the book Future Shock, said something really interesting. He said that the illiterate of this century will not be those who can't read or write. He said that the future illiterate of this century will be those who cannot unlearn and relearn. And I think our institutions, our hospitals, our governmental bodies are stuck in a rut. They're in a rut. And someone one day is going to come over to them and look in and say, hey, buddy, you're not in a groove, you're in a rut. So we have to step out of that groove and move forward. So it's about unlearning and relearning. It's opening our imagination to what can be in the context of that synchrovation.
John, maybe we want to follow up with this last question for you. How can the private sector effectively engage and establish partnerships with governments or policymakers and other key stakeholders? And can you give us an example or a situation when this has been successful or failed?
Well, I think that the government and regulatory bodies are not the lightning. They're not the innovation. Good ideas don't come from government. There, I said it. I know I'm gonna get in trouble, but I think that what government is the lightning rod. Government is the lightning rod. And what we have to recognize is that good ideas come from the private sector. Now, the private sector is not only big pharma or big business. The private sector is an electrophysiologist working in his garage who comes up with an EKG machine. So we need to recognize that governments have to be receptive to innovation. So I think that's probably the biggest takeaway, because they are not the arbiters of, I would even argue, brilliance. They are not the arbiters of innovation. They are the landing ground. They're the runway upon which innovation must land. So I think that industry is an essential partner. And that partnership is that duality of lightning and lightning rod. And by working together, we can solve powerful solutions. I think that the example of mRNA vaccination is an example of where industry, where innovation came together and worked very quickly in the context of a social imperative and also regulatory opportunities to really move faster. So that's an example of where the successes happen. So it's really, it's a matter of finding that unique opportunity and coddling it, taking care of it. Because interestingly, innovation is precarious. And when we talk about innovation in healthcare, it's even more precarious because that insight comes from that mom or dad who has a child with a rare condition. And those are not the Elon Musks of the world. Those are not the people who can stand on a soapbox and yell. Those are the people who whisper. And it's those whispers that we can find true innovation to health.
I think long-term partnerships, especially between governments and the private sector, really contribute for good success. But some things that I think, one thing that I've seen, and I would like to actually encourage more to happen, especially within healthcare, is the idea of a digital marketplace, especially in procurement. That means, and this is in government. This happened in the UK, and it has enabled innovation incredibly well, because first you go into this marketplace, you offer your services there, you are validated, you are checked, you know, there's due diligence done. So it's not just, you know, we come up with a solution and just offer it. So there is due diligence in place. And then you offer transparent pricing and upfront. That's what government wants at the end of the day. And a part of that also brings in the transparency of how much money is given to which private enterprises. Of course, you're going to have companies who have millions, but then there might be other companies who might have less. And it's showing that you are also encouraging and empowering. I mean, it doesn't come without issues, but I think having this idea of government approved digital health suppliers and having a whole network behind this, I think it's going to enable incredible innovation, just allowing this. So sometimes the old way of doing procurement doesn't necessarily translate into the best digital health interventions or solutions, which are inherently, you know, updated and supplied, you know, by third-party suppliers most of the times, especially this is in government. But I think also that government needs to consider building as well, having like this balance between private sector and also in-house talent, you know, having this combination of both. So, you know, having new roles like a chief data officer, for example, in an organization to enable this, chief data scientist, you know, having customer relationship management developers within the organization to kind of bridge that gap. Even people who are focused simply on business intelligence. And sometimes it might be something as simple as including a new pay scale within the government pays. So sometimes different governments have different pay scales. And many times new roles can't be created because there isn't a pay scale for it. Or that role doesn't exist or didn't used to exist 5 or 10 years ago. So there's like this mix of financial packages and established roles, the need for new established roles. This is not just in healthcare, mind you. So I think that every ministry, for example, within the government data officer, not just a chief information officer, and coupled with it, I would even look at even chief transformation officer. So bringing all of this together will be magical, you know, in the long run.
In public sector, of course, public health has a very important role in framing the market for those products which are coming out of innovation. And I think that the government has a very important role as an enabler. It is not, it's not the role of the government to produce technological innovation, but it's also but it's financing them. For example, I understand that these vaccines, mRNA vaccines, part of the work was financed by the government. So the government does have a role as an enabler. And the innovation which is happening within government, they are governance innovations, which are of a different type. They are not technological, but good policies, good ways of administering markets. They are also innovations, but they are not of technological type, but they are social type. There's one thing I would like to, because we have been discussing a lot about the kind of a great promise that the digitalization gives us. And I think that we are all believing in that. There's one important thing which we need to keep in mind, which was put on the table very clearly by the French presidency of the European Union the day before yesterday, on Wednesday, because the French government wanted to promote digitalization in healthcare, but they said that we can only do it in an ethical way. So the French government put forward a declaration of ethical principles in digital healthcare. And that was an enormously interesting paper, because very seldom we speak about these ethical aspects in digitalization. Of course, it's not limited to healthcare, but it's the whole digitalizing in society. One aspect, they have 4 pillars there. One of them is an eco responsibility of digitalization, that which was a new concept to many attending the conference. But there was another concept which is very important, and we shouldn't forget it in this discussion either, and which was referred to by Stefan, who spoke about the person who doesn't have an email address. The question is that how can we make sure that when we do this digital innovation and new digital systems, how can we make them inclusive? So that how can we make sure that everybody can benefit from them? And definitely, we cannot allow a situation that we create digital barriers to care, that you can only access care through digital systems, because if not everybody can do that. And therefore this digital health for all principle is so important. And until now, we have been so fascinated and so occupied by promoting digital innovation that we have forgotten to make sure that that development is inclusive. And I think that this is one of the things we have on the table in the coming years to make sure that everybody has access to digital benefits.
And we wanted to do a quick round robin in terms of asking each of you, any final thoughts, final messages or takeaways that you want to leave us with, or anything that we didn't ask that you really want to share with us. That'd be great if you could take a minute or so to say that.
I can jump in. I think an important takeaway is that the true nature of innovation and even magical innovation, as Stefan alluded to, is not only the innovation itself, but the integration of multiple innovations together. So really, it's the magic of artificial intelligence combined with imaging, combined with cloud computing, that give us new modalities. So it's about that collaborative dynamic where we apply multiple innovations to these comprehensive and integrated innovation solutions. That's really where the magic lies today.
If I may, I think once we put the human at the center of the equation, and not just like, for example, because sometimes this patient-centered approach sometimes can be problematic, but rather inclusion. So putting out a listening ear, simply listening, not just hearing, but listening, I think will enable a lot of challenges to be overcome. Something as simple as listening to a concern. And then all of a sudden, you have that person, you've won him over simply by listening to that person with a simple concern. It could be something extremely simple, like, should I worry about money? No, for example, there has been the budget set up. Should I worry about people checking this data? No, there is a regulatory framework supporting and ensuring and protecting you. So the more we listen, the more we know the challenges ahead of us and the barriers to entry, and the more we'll be able to jump one barrier after another simply by listening. And today you are starting this already. You're starting this already by listening to us. So that's already a great start. So the more we listen and the more we act appropriately on what we've listened, the more we can move forward. I think that's really and truly the crux of health innovation.
Thank you, Stefan. And Tapani, any last words?
I think that we have to keep in mind that digitalization is there to help to deliver healthcare, and help people. Digitalization is not an aim in itself, but it's a powerful tool. And it's also likely that the digitalization will transform healthcare when it's really getting ahead. But while we are changing and transforming the healthcare, it's important that we keep everybody on board. A little bit like we have been discussing that it's important that both citizens, patients, and health professionals, they find it easy to use the systems, and that we are keeping everybody on board. We have digital health for all.
Thank you. Thank you very much. And I guess thank you to everybody just on time to wrap it up. And it's been a true pleasure from our side. I'll let Ana Rita, say goodbye and close the meeting.
Oh, I am not exaggerating at all when I say the world is blessed by having you in it. Not only because of the brilliance of your thinking, but your generosity in sharing what you know and what you think and your opinions and everything you've done today. I feel truly blessed to have heard you. I hope that, as Stefan says, this is the beginning of a powerful conversation that needs to happen, but we felt that nobody was willing to have it. We hope to share this and share it and share it and share it to create the momentum that is needed. So I want to thank you, Maru and Cheryl, for having put this together and found you and bring you to make us more wiser. and thank you so much. And I hope you have a wonderful weekend and that you continue your work.